everyone. Greetings of the day, everybody. I'm Priyanjali from Beautiful Spotless Skin team. I'm sure all of you must be keeping good health. You must have come across people, especially women, with brown colored patches on their face. They seem like freckle like spots forming large flat patches. This is nothing but melasma. Melasma is a common chronic skin condition in India. According to study conducted across 4 Indian cities, revealed that more than 80% of the population present skin color heterogeneity on the face, irrespective of age and gender. This heterogeneity mainly results from hyperpigmented spot and melasma. Indian skin tone is more susceptible to pigmentary disorders. It occupies mainly in women, which is 90%, and 10% of males of all ethnic and racial group. Around 20 to 30% of 45 to 65-year-old women present a facial melasma. Melasma and hyperpigmentation is generally ignored as a sign of aging and often is misunderstood as a skin condition. Melasma sufferers have been misinformed about aspects of this common hyperpigmentation issue. This can lead to frustration setback in treatment. To avoid all these hassles and to keep you informed today, we are here to know about the management of melasma from expert. Today we are honored to introduce Dr. Minakshi Pandey, a renowned skin expert from Mumbai. Dr. Minakshi Pandey, MBBS DVD dermatology, a highly skilled dermatologist and cosmetologist with comprehensive training in both clinical and aesthetic dermatology. She completed her MBBS from MIMSR Medical College, followed by an internship at the prestigious KEM Hospital. Dr. Pandey further specialized in dermatology with a diploma in dermatology, venereology, and leprology DVD from KJ Somaya Hospital, and also holds a diploma in cosmetology. With her extensive expertise, Dr. Pandey excels in diagnosing and treating a wide array of skin, hair, and nail conditions, as well as performing advanced cosmetic procedures. Her strong foundation in evidence based medical practices, combined with her passion for aesthetics, made, has made her a trusted name in dermatology and cosmetology. She has been working efficiently in this field for the past 10 years now, and today we have her here with us. We are privileged to have her with us today, and she will be sharing her insights on melasma and its management. With we extend our heartfelt gratitude to you, Doctor, for joining us today. Without further ado, let's dive into the first question, which is what is melasma?
Yeah, a very good evening, and I'm so honored to be a part of this. So, coming back to our topic, which is melasma. If we have to define melasma, then it is an acquired, symmetric hyperpigmentation of the centrofacial area, which involves the nose, the cheeks, the forehead, the chin. Sometimes it also involves the malar and the mandibular areas. So basically, it is an hyperpigmentary acquired symmetric disorder of the face. And if we come to its causative factors, then mainly the female sex hormones, which are estrogen and progesterone, that mainly causes the pigmentation in the skin. The estrogen and progesterone is responsible for increased melanin production from the melanocytic cells which are present in skin of the face, and in presence of UV radiations, in presence of the sunlight, this melanin production is increased by fourfold. In presence of the estrogen and progesterone and UV radiations, all these factors leads to formation of hyperpigmentation of the skin. Yeah.
Now, now that we know what is melasma, Doctor, what can be the main cause behind it?
It is a multifactorial disease. The most common cause for this, as I've mentioned, it is because of the female sex hormones, which are estrogen and progesterone. In influence of estrogen and progesterone, the alpha melanocytic stimulating hormones levels are increased in the skin of the face, and which stimulates the melanocytes to produce more of the melanin, which results into formation of hyperpigmentary brown patches of the face. So this is the common
Okay.
cause. The other cause is the UV radiations. There are many
Hmm.
other causes. For example, oral contraceptive pills. Sometimes female take it to prevent pregnancy. that leads to melasma. Pregnancy is the major cause. We have seen a hormonal shift. There is a major hormonal shift during pregnancy, so it is one of the major cause of melasma. There are certain phototoxic drugs. Cosmetics is also responsible. Some cosmetics is also responsible for formation of melasma. Yeah.
Right. So now I have so many questions to ask. Firstly, doctor, it is very hard to identify a condition in the initial stage, especially a condition like melasma, because it mimics freckles. So, how do we firstly differentiate between the two? And secondly, can it be hereditary transmitted?
Yes, melasma has a strong genetic influence, as we have observed in many studies where twins has been affected by this, which means they have some sort of genetic predisposition. Persons suffering from melasma have either they have hyperactive melanocytic cells, or there is an increased production in the melanocytes which are present in the skin. So it has a genetic predisposition, for
Hmm.
sure.
And the
And what
first question was, yeah, how do we understand that this is melasma in the initial stage? Because it is definitely easier to cure a condition or treat a condition in the initial stage.
Yes. Firstly, the clinical picture. The clinical picture are different. In freckles, we see small 2 to 3 spots, which are uh, present mainly on the malar regions. And in melasma, the spots, the pigmentation are brown in color and are very diffuse. And it is present on the centrofacial area of the skin, like the nose or bridge of the nose, like on the forehead, then on the cheeks, and the malar and the mandibular area. Freckles are also present on other sun exposed parts of the body, for example, the back of the hands, on the extensor parts of the hands, and on the back where the skin is exposed to the sun. And melasma is
Right.
predominantly present on the face. Yeah.
Right. Great.
Also,
Now,
we can
doctor,
differentiate from various, like wood lamps is also there. If we have any confusion, then we can, anytime we can go for skin biopsy. Yeah.
right, right. So again, we are saying that uh, knowing your skin is very much important. For that, you definitely need to visit a dermatologist. People who are treating it by themselves, or applying ointments or creams, or there's so many products, thousands and thousands of products in the market nowadays, and people are extensively treating themselves at home. So so basically, the first thing we should do is get yourself checked once. Just sit for a consultancy. I think that itself will solve a lot of problems which is which has occurred or which is about to occur in the near future. Now, moving ahead, doctor, you mentioned UV rays can be one of the major reason. So, are we saying that not applying sunscreen can be a reason, or people who still believes that it's just a marketing gimmick, and I mean, people are just spreading the awareness of the importance of sunscreen, because this is a huge business now. I mean, sunscreen business, not just skincare. We are not talking about any skincare here, but simply sunscreen business is huge, because doctors are promoting, dermatologists are promoting, people nowadays who are aware of the skin, they are promoting. So why all of a sudden such a change? I mean, we have never heard that we should apply sunscreen. I have never applied sunscreen when I was young, or my mother never told me to do that. So I don't think so my mother also ever did that. I mean, she does not include sunscreen in her skincare regime till date. And I know a lot of people who doesn't. So is it true that sunscreen is very much important for the skin? And as you have already mentioned, for melasma, UV rays can be one of the reason. Can sunscreen actually protect our skin from the UV rays?
Yes, yes, definitely. Sunscreen is very important because the UV radiations causes damages our skin and releases many free radicals, which are very toxic to our epidermal and dermal cells. Not just in the perspective of melasma, there are many things like aging. We get wrinkles at an early age, like when we hit 30,
Hmm.
35. we our skin starts showing signs of aging. It is because of the damage causing
Hmm.
by the UV radiation. So it is very important to include
Right.
sunscreen in our daily routine to protect ourselves from the free radical damage caused by the UV radiations. Also, we Indian skin comes under the Fitzpatrick classification as 3 and 4, which is very much uh, which is very much into this thing that melanocytic tanning is more seen in Indian skin because it comes under the classification of Fitzpatrick 3 and 4. So it is very important to protect our skin by the usage of sunscreen. Yeah.
Right, right. Now, because we are talking about sunscreen, let us know a little bit more about sunscreen again. How much to apply, when to apply, even if people are at indoors, like the lady, the homemakers, we can say, should they also use who are not regularly exposed to the sun? Also, is reapplying sunscreen important? Because we have also heard dermatologists suggesting that applying sunscreen once does not do the work. You have to reapply it. So, yeah, those would be the questions.
Yes, sunscreen depending upon the age it is given. If patient is younger, we prefer generally lower SPF sunscreens. If the patient is
Mm.
above 35-40, we give them a higher strength of sunscreen, which is at least 50 SPF sunscreens we generally prescribe.
Right.
Also, depending upon the physical activity, whether the person is playing sports, if the person is below 15 years of age. So there are many different sunscreens. If the patient is having a pimple prone skin, so that person should use a gel based sunscreen. If a person is less than 15 years of age, then they should use physical sunscreen, zinc oxide. And chemical sunscreens SPF depends upon the skin condition. If we talk about melasma, then sunscreen of 50 SPF is required.
Right. Uh, how much to apply, doctor?
Hmm. The effect of sunscreen wanes off in 3 hours. So every 3 hourly we need to apply it. So you can make a schedule like we have to apply at 9 a.m., then 12 p.m., then 3 p.m. So every 3 hourly we have to repeat the application of sunscreen. But nowadays we have this benefit that sunscreens are coming with a long mode of action, so we can keep that works for 8 hours also. So
Okay.
that sunscreens can be applied once a day also.
Okay. So now, in today's live, we are talking about basic things, very basic. People might be wondering what sunscreen. We know already about such things, but we tend to always miss out on the basic things. Now, if you see, I know a lot of people, especially men, the way of applying cream is they'll take the cream on the palm, they'll rub it on the palm, and then apply it on the face. So I have seen so many people doing that, but that is actually not the right way. Doctor, can you tell us the right way to apply sunscreen on the skin?
It should not come from palm to the skin. First, it should be applied over the skin. Like you can take it. The amount of the cream should be from start from the tip of the index to the this first line. This is the amount you should apply. This is the amount which is needed for application in whole area. So first you can take the cream starting from here till here, and then pea size should be put on the face, and then we can apply. Then we can rub the skin. It shouldn't be like from hands to face. It should be from face to hand.
Very well. So that was all the information you require for sunscreen. And in case for all the people who are wondering which sunscreen we should buy, we are so much confused. This is not suiting our skin. I mean, there are so many sunscreens available in the market nowadays and huge marketing. I mean, all of them are good. But people who are confused with the kind of sunscreen you should buy for your skin, you should definitely visit an expert or go for a consultation to your nearest dermatologist. Moving ahead towards the next question, doctor, can you please tell us the risk factors of melasma? Uh, I mean, it's the mainly, of course, it would work a lot on our self confidence because the face is affected mainly. Apart from that, what are the other risk factors, or are there any risk factors?
No, there are no risk factors in melasma. There are no studies which shows that it converts into a malignant form. Or it's affecting any of the tissue or organs in our body. So it doesn't
Hmm.
have any side effect or direct effect on body. As you have rightly mentioned that it obviously it has an effect in our psychological psychosocial impact
Right.
in our self esteem and self confidence. So treating melasma is important. It's not like it's not harming your organ or any tissue, but it is having a mental or psychosocial effect, so definitely it should be treated.
Right. Now, also tell us, doctor, what is the difference between what is the difference between melasma and hyperpigmentation, or is it the same?
No, both are very different. Hyperpigmentation is a result of if a person is suffering from any allergic condition, or there is any inflammation in the skin, or is there any infection of the skin. So once the infection or inflammation has gone, it has leave that mark, the pigmentary mark, which is temporary, and it will go off in sometimes. Whereas the melasma is a chronic condition, it is not temporary, it is going to stay there for long. So it is a chronic condition first. Secondly, it has a typical picture. It is symmetrical, acquired, whereas hyperpigmentation is not symmetrical. Uh, so
Hmm.
that's the
Right.
difference. Yeah.
Right. Now, moving ahead, doctor, how do we usually diagnose melasma?
The clinical picture is generally very clear to diagnose this condition. To rule out is ruling out melasma is very easy. If there is doubt, or if a patient suffering from two or three illness at the same time, then we can always check on Wood's lamp. Wood's lamp shows pigmentation in the dermal and epidermal. Shows pigmentation in dermal and epidermis, so we can get correct from that. Yeah.
Right. Uh, well, what about the treatments? What if a person or a patient comes in the early stage? What are the kind of treatments we normally advise the patient?
Firstly, just like we have mentioned that protecting ourselves from UV radiations is very important. So sunscreen
Hmm.
should be a routine in any person suffering from melasma, whether the
Hmm.
patient has recovered from melasma, even though that person has to use the sunscreen, because
Hmm.
there is a chance of recurrence of melasma. So strict, not just chemical sunscreen we have to apply. We also have to take a physical protection in the form of using umbrella while going out in sun. Females can use scarf and males can use cap or hat, anything which gives a physical protection from the sun. So one should make a routine to protect themselves, their face from UV radiations, because it leads to free radical formation, which increases the melanocyte production. So it is very important for to take sun protection. Secondly, over the counter medicine should be avoided, because it leads to skin irritation or many side effects in the skin. Melasma is a chronic condition, so we have to take a holistic approach, starting from tranexamic acid orally as well as topically. There are many preparations like kojic acid and arbutin has shown promising results in melasma. If such holistic approach doesn't work, then we can shift ourselves to hydroquinone. Hydroquinone 4% is also very effective. I've seen good results with hydroquinone 4% in my clinical practice. So hydroquinone 4% is also a good option while treating melasma. There are other options also apart from application of creams. There are chemical peels. If we add chemical peels in our routine treatment, then the chances of recovering is higher if we use peels alone. Also, if we have to counsel the patient, like if they are using any oral contraceptive, then the female should stop the use of OC pills because it is causing her melasma. So we have seen that once the OC pills have usage has been stopped, the melasma has recovered. So counseling of the patient is important, sun protection is important. Also, considering this fact that it is a chronic condition, we need a long term treatment. So we have to use the treatment which are safe for the skin. The uh, old method of treatment which includes the hydroquinone, steroid, and uh, retinoids are not very effective these days because it is going to recur. So we cannot use that preparation for longer period. So one should avoid retinoids, steroids, and hydroquinone combination. We can use other approaches like hydroquinone is a good option along with chemical peels.
Right. Now, doctor, I mean, we had a lot of things coming from you, but for other people who are aware of the kind of things doctor has just mentioned, like the medications, like the creams which are available widely in market. I mean, there are a lot of products which include such term in below that this has this has this. So apart from that, people who are self-treating themselves, they are thinking कि अभी तो घर पे ही ठीक हो जाएगा, अभी तो हम मार्केट जाएंगे और I'll go and get this and then don't do this, please. Please do not do this. Today's session is just to educate you. Uh, it's not any consultancy. Consultancy can be only done on one. You have to come visit because everybody has a different skin and everybody does not require the same kind of medication. Please, who are suffering, uh, make sure that you are different. Do not follow the influencers online and also uh, internet is so much widely used nowadays. You get every possible thing in the Google or internet nowadays. Uh, watch the videos, be aware of that, and know the consequences. But please don't treat yourself. Now, after the information of the medications, the doctor, is there any way how one can treat themselves at home from melasma? Because also Indians, we have our medications in our kitchens. So we get every possible thing in the kitchen, and people like applying everything on the skin. Like the thing which we eat, they probably apply it on the skin, and somehow they also believe that these things work. So does it work? And if so, that is there any other way which how we can treat melasma at home?
Apparently, I don't think there is any homemade treatment for melasma. If we talk about hyperpigmentation or uneven skin tone, or just the skin is dull or there is a tanning, then we can use homemade remedies. But for melasma, it is a deeper, it is not superficial, it is a very deep etiology. So it affects your epidermis as well as dermis. Dermis is very deep inside the skin. To get deep into the skin, we need some approach or the medications which works on the deeper level. So superficially applying anything will results into melasma treatment will won't happen. Yeah.
Mm, mm. Right. Now, also, doctor, you have mentioned that having a holistic approach is very much important when we are talking about melasma. Um, uh, is it possible that a person has cured completely? You have also mentioned that reoccurrence of melasma is also possible and can be seen. So, is it possible that the patient has been completely treated and he or she is not having such reappearance again throughout the life?
Once the melasma has recovered, in order to prevent its recurrence is very important. So one has to stick to application of sunscreen. One has to also undergo sessions of chemical peeling. If the person is going chemical peeling once a month, then later on they can shift to twice, once in 2 months or once in 3 months. They should continue getting chemical peeling treatment or the maintenance therapy for melasma, like creams containing tranexamic acid, kojic acid, or arbutin, niacinamide. So these work very effective during maintenance therapy of melasma. So one should not, if the melasma has been recovered, then one should not stop using medicines or stop using sunscreen. One has to continue the use of sunscreen and maintenance therapy in order to prevent its recurrence.
Right. So now it's for all the people. See, firstly, aging can't be stopped. You will age. This is very natural. Same way is for our skin. I mean, all the people who watches their idols and who thinks ki wow kitna acha skin hai, you do not know the work behind it. It's probably the consistency of daily usage of skincare. They are using skincare. If you go and check out their lives, skincare is so much important. Today we are talking about melasma here, and doctor has already mentioned about the maintenance therapy. You anyway to have a proper good skin, you need to maintain it. It's all maintenance that you're getting to see in front of you, and you're wondering ki what beautiful skin the person has. So behind that there is a lot of work, and you cannot consider it as a work, because that will indirectly bring a lot of stress in you. So just think it as a part of your daily routine, just the way you get up early in the morning and brush is a daily routine. You cannot consider it as a work. Ye kaam hai hamare liye. You cannot think that. That is not natural. Just like the same way you have to consider your skincare, the medications, people who are suffering from melasma, the skin applications, you have to consider it as a daily routine that you have to continue throughout your life. I think that will make your life much simpler. And acceptance, of course, accepting the fact that you have melasma and it will stay with you forever. Just accept it. That will make it much more easier, I believe. So maintaining yourself is not a bad thing, I think so. People who are also healthy, people who like staying fit, it's maintenance. You have to maintain yourself in order to look good. Everybody should do that, I believe. Give yourself some time. Giving yourself time is very much important. Today we are talking about melasma, but anyway, if you see, maintaining yourself is so much important, doctor. We tend to forget it in the daily hustle and bustle. There is so much pressure. People are taking so much stress. Uh, like we are talking about stress now. Tell us, doctor, can stress somehow trigger the condition as well?
Yes, stress plays a very important role in such conditions. In many, not just melasma, there are many skin conditions which are triggered by stress,
Hmm.
including right from hair fall to trigger of psoriasis, eczema. So all these conditions are related to our stress level. So I always ask my patients to keep their stress level down by following yoga or meditation. So the skin conditions, the medications which are going on will further help in improvement of the condition. So it is very important to keep the stress level down in order to cure the skin diseases.
Right. Well, stress anyway can lead to a lot of negative effect on your health, not just melasma, but a lot of negative effect. So try and stay away from stress. It is very much easy for anybody to say कि "Eh, stress mat lijiye, stress क्यों ले रहे हैं?" But it somehow naturally comes. We know that. But try uh, thinking about yourself, giving yourself some time, loving yourself. Very much important to love yourself. Everybody, we are talking about melasma. That's why. That is the reason I'm mentioning this point. That please love yourself. Don't think कि अभी तो ये ठीक नहीं होगा. It's gonna stay forever. Don't do that. There are a lot of people sitting down there just to help you out and treat you and make you look good. Do not lose your confidence. Love yourself. Love your skin. Moving ahead, doctor, we have also heard a lot of people saying that melasma can somehow trigger cancer. Is it true?
No, no, there are no studies or no case reports available which shows that melasma can turn into a malignant condition. No, no studies.
Right. Uh, well, doctor, many people. Well, I think we have already talked about this, but because it is about skin, we also somehow wonder ki, let's not get into a contact with the person. By contact, I mean skin contact. So, is it possible that the condition can be contagious as well?
No, it is very indigenous. It doesn't spread by contact with the person. it is
Hmm.
hormonal. It is an hormonal infection issue, and not it is not infectious. So it is no, it is not spreadable.
Right. With that, I can see some questions coming up from the viewers. The first question comes from Deepak Saxena, asks, is melasma linked to a oral? I think we have already talked about this, Deepak, but again, doctor, do you want to add anything to this? Is melasma linked to oral contraceptives?
Yes, oral contraceptive have direct relationship with the formation of melasma. So it is one of the part of the treatment that counsel the patient to stop oral contraceptive if the patient is suffering from, and one should use other measures of contraception to prevent pregnancy because it has a direct relation in formation of melasma.
Right. Uh, Now we are again and again talking about uh, the female here, because mainly we get to see the condition in the females. What about men, doctor? What kind of maintenance therapy should they take in, and what are the risk factors for the men?
Uh, the treatment part is same for both the both males and females. There is no
Mm-hmm.
difference in etiology or its clinical picture or anything. There is not much difference, although melasma is predominant in female, like 80% of the cases are seen in female. There are very few cases of male melasma, but the treatment part doesn't changes with the gender.
Okay. Now moving ahead, the next question, doctor, comes from Jyoti Singh, who asks, can melasma appear after a facial injury?
Yes, since melasma is also related with stress, so any form of stress, whether it is a physical stress or emotional stress, it can lead to increase if melasma is already present. So it can results into the increasement of the melasma. Yeah.
Right. The next question comes from Surya Kumari, asks, can melasma be present at birth?
No, the melasma can only be seen after puberty once there is insurgent of the estrogen and progesterone hormones. So there are no cases before puberty.
Right. The next question comes from Lucky Sharma, who asks, can melasma affect the forehead?
Yes, melasma is predominantly present at the centrofacial region, which involves the
Mhm.
cheeks, bridge of the nose, forehead, upper lip, and chin.
Okay. Uh, the next question is similar question, which you have just answered, doctor. Raju asks, can melasma affect the lips? How does it look, melasma in the lips normally?
No, no, the lips are not affected by melasma. No.
Mm-hmm. Upper lips you mentioned. The upper lip is the part where we get
Upper lip
can get
is
to
the
see.
part. Yes, lips are spared in melasma. As lips are not involved, although we get pigmentation of the skin, but that is not
Mm,
melasma.
right. So we get to see a dark like patch on the lips appearing at times, or there are also times when we suddenly get to see a spot, a black spot, which remains for the rest of the life actually on the lips. So what is that actually?
If we are getting a sudden spot, it might be related to fixed drug eruption. When we take
Mm-hmm.
some drugs like antibiotics or antipyretic for fever or viral infection, so
Mm-hmm.
that causes a fixed drug eruption, which commonly occurs on the lips. It is mainly because of antibiotics usage in certain bacterial or viral infections. So that causes the black spot on the lips. Yes.
Yes, we have also talked about medications, over-the-counter medications. You are that can also somehow trigger the condition. People who are uh, extensively using over-the-counter medications nowadays, people are basically living on tablets. Everybody, I've seen people having so many tablets at once. Whatnot. I mean, the doctor is not even suggesting the person to do so, but you keep on doing that. Do not do that. Do not go to a chemist and ask for medications. Make sure that you visit your expert no matter whatever you're treating. Please do not go and ask the chemist for a medication. The next question comes from Ravi Singh, who asks, does melasma affect both side of the face equally?
Yes. Melasma, by definition itself, it says that it is an acquired symmetrical hyperpigmentation of the centrofacial area. So by definition itself, we can say that it is symmetrical. Yes.
Right. Now, doctor, what if a mother is about to conceive and she is suffering from the condition? So, do we get to see? I mean, what is the percentage that we get to see the same condition in the child?
Uh, since we have seen that there is a genetic predisposition, so the child at birth won't be suffering from melasma, but there are high
Hmm.
chances that after puberty or during their pregnancy they might get this condition.
Yes. So now for all the people who are wondering that he or she can be the one, are there any preventive measures for them?
Yes, if the person is having a genetic predisposition, like their parents suffering from this condition, then there is a 25% chance that the person might can suffer in future. So one can always
Mm,
take precaution, like taking sun protection, taking precautionary measures.
mm,
If it is about to happen, then it will happen. There are no
mm,
any
mm, mm.
preventive measures to prevent this condition, but we can anyway anytime we can delay this condition by using sunscreen, chemical sunscreen, as well as physical sunscreen.
Right. Also, because we are talking about skin, doctor, food also plays a very important role. Hydration plays a very important role. So, are there any relation of our diet or hydration with melasma?
Diet and hydration is overall is we need to follow a good diet and hydration to keep our skin hydrated. uh,
Hmm.
all we have to avoid is certain drugs which aggravate this melasma, like anti-seizure drugs or some cosmetics which causes melasma. um,
Hmm.
there are oral contraceptives that we need to avoid. Otherwise, eating healthy or keeping hydrated is overall good for your skin, but that is not the treatment of melasma. But we can
Right.
eat healthy food to avoid it. Yeah.
Right. Very well. We had a wonderful discussion on the topic today, and we got to learn a lot from you, doctor, today. Before we take a leave, any take-home message for our viewers who has watched us so far?
So melasma is not a condition which is going to harm your body. It is just a hyperpigmentary disorders. Just your cells which has engrasped, which has started producing more melanin. That's why the person is having this. The major impact which it has is psychosocial impact. So to one should not have that psychosocial impact. One should always visit a dermatologist for correct regime or treatment. So that's the only message, that do not try over the counter medicines. Always visit a dermatologist in case you are suffering from melasma. Yeah.
Right. And all the people who are wondering I mean, people in their 50s or 60s who are wondering कि let's just give up now. Anyway, अभी तो सब खत्म हो चुका है. Don't do that. It can be treated. Okay, we are not saying that it can be cured completely because, as doctor has mentioned, that there is a tendency that you can reoccur it until and unless you are maintaining it throughout your life. There is a tendency that you can have it again. So do not leave your hope. Make sure that you are thinking about yourself, you're caring about yourself, and self love is above all. Thank you so much, Doctor, for your valuable time today. It has been a very informative session for our viewers, and it was great to hear from you. We really look forward to many more such sessions in our near future. And also, thank you, viewers, for your excellent participation in today's session. For more information and updates, stay connected on our beautiful Spotless Skin page. Thank you so much. Have a nice evening. You all take care. Stay safe and stay healthy.
Thank you.